about health justice and the social determinants of health. Justice is just about righting a wrong for a group of people, and when you right that wrong, it benefits the whole. So as a Native Black American whose lineage has contributed to America, someone like Martin Luther King is one of my greatest idols, because he fought for the rights of African Americans, and the civil rights law was passed, but it benefits everybody. So when you right a wrong for one group, it just benefits everybody. So when it comes to health and justice, the Bronx is number 62 out of 62 counties when it comes to health. We are dead last when it comes to health disparities. The Bronx has the worst health in New York City, and is the poorest congressional district in the U.S. So if we can right that wrong, it benefits everybody. So we have a highly concentrated poverty in the Bronx, and it leads to this health disparity. And so I believe the New York Health Act can level the playing field for a lot of people. Right now, my grandmother, she's in Montefiore right now. She's 93. She had a hip fracture. She's doing very well, strong lady, very strong lady. But now we're looking for rehabilitation for her. So we're trying to pick some place that's close to family to get to, but the insurance, oh, we don't accept that. We don't accept that. We don't accept that. So something like the New York Health Act would definitely level the playing field. It would make it easier for families to connect with their loved ones. You want to travel far away to get the help that you need. If everybody accepts the same kind of health plan, then you can go where you need to go instead of where they're telling you have to go. So that's leading into the social determinants of health. So the social determinants of health, because I have a brief amount of time, I'm going to have to just explain it very shortly. It's basically the factors that lead up to actually going to the hospital. So social determinants of health is more so about prevention than it is about just getting sick and being inside of the hospital. So social economic status can determine your health outcome. We live in New York, where your health outcome can be determined by your zip code. So someone who lives in, I live in 10468, the health outcomes in my area will be totally different from someone who lives, I always use this analogy, there's a Park Avenue in the Bronx, there's also a Park Avenue in Manhattan, and there's two different total health outcomes, and they're both on Park Avenue. So with that being said, that's what the social determinants of health is, beyond someone's personal choice. It's other factors outside of their personal choice that can affect them and send them to the hospital. So if I'm eating correctly and I'm doing yoga and Pilates and I happen to live in Port Independence, I can go home and get sick from Legionnaire's disease that's in the water inside of my building. And Legionnaire's disease is usually something that's found on cruise ships. It's inside of a building. So that's something that is the social determinants of health that can send you to the hospital. One of the ways that the social determinants of health can help is by kind of like non-traditional ways that the hospitals can use resources to prevent re-entry into the hospital. So the Northwest Bronx has a healthy buildings project, and the healthy buildings is basically about asthma. So if there's an asthma cluster of people who live in a building who constantly keep returning to the ER for the same thing, then chances are there's something in the building that's triggering the asthma, that's sending them, even though they've got the medication in the hospital, when they get home, it re-triggers the asthma, and then they're back inside the hospital again. So the Healthy Buildings program is about removing those asthma triggers out of the building, and it's a partnership with the Department of Health and Montefiore. So I am at time, but you see how something like the social determinants of health can benefit the community as far as preventative measures and do non-traditional, holistic ways of preventing illness and return visits to the hospital. So that is my time. I'm up, but support the New York Health Act, and I'm going to have Steve Penny.